Hello, my name is Collan Koeppen D.C. and welcome to our Ergonomics home care class. Ergonomics has to do with workplace efficiency in your body position while you're working, because in the modern environment a lot of people are at desks, they're seated, and we assume that sitting is the most optimum way to work. And I'd like to come here and say that sitting is one of the worst things you can do for your body balance, especially for your lower back. Eventually, of course, what I see over time is that with the sitting position, the low back flattens. I'll move over here a little bit. And the head goes forward. So let's say you're driving, you're studying, you're working, and this happens. And I know in life we sometimes see people that are walking around hunched over, looking straight towards the ground, going down. So in general, if you think of, do you want to go down and end up in the dirt, or do you want to go up and go up this way? We tend to think up this way is good and down that way is bad, is a general rule, and I'd like to say that's true. My number one rule when it comes to ergonomics is sitting down is not good for any extended period of time. And you might ask me, well, do I ever sit down? Yes, I sit down for short periods of time. But if I could do any one thing to help my overall posture, body balance, reduce pain, and improve efficiency of your workplace, I would have you stand. So you see right in front of me the standing desk is the first example. We do have this in our office. I didn't just buy this for today. This came straight from our office down here to show you what this is all about. So one of the first things I want to do is show you something that is too low, because you can have the best intentions in the world but not have the right application of those, meaning I intended to get a standing desk and it should work well. However, I set my computer on the wrong level and is down too low. So if I'm here and I'm all feeling good about myself because I have the standing desk, and then I'm hunched over, I can't see my computer well, and I'm hunched over doing this, that's not the right body position, and it will eventually lead you to having the forward head, flattened low back, and the postural concerns, tension and spasms here, and what we think of as normal. However, it's not normal, but they're the typical stress patterns. They're typical, but they're not the way we need to live. So part of what I want to do is show you methods to, number one, avoid them in the first place, which is prevention is the best form of cure to not get it in the first place, of course. And then if you do happen to have these concerns, we'll show you ways to get rid of those as well. So number one, obviously, at my height, everybody has a different height, but at my height, I'll put the computer up to a higher level. And there's many different styles of ergonomic standing desks that you can use. You don't have to get really fancy and get the one that has a treadmill and the pool that has a treadmill in it. I don't know if you've seen that. There's a lot of contraptions coming out now that can provide exercise while you work and that type of thing. But as long as you have the wrist and hand angle at 90 degrees, you can see if it's down too low, you'll find that I'm hunching and leaning forward. And the other thing you want to avoid is having the wrist flexed for extended periods of time. It causes bulk in the musculature, in the flexor group and the pronators, and they used to do carpal tunnel surgeries from this, and they found out that they're not effective over time. But back to the basic ergonomics. We're going to start from the hands and go up to the head. So wrists not flexed, and certainly also not extended. You want them near neutral. So neutral, if you imagine the bones in the wrist and hand, the bones in the forearm. Neutral has a range, just like so. The other thing is from elbow to shoulder, and you want to have it to where there's an eye level screen, and there can be a certain angulation downward that the eyes can tilt down. If your eyes can look down and your head doesn't have to move, that's okay, as far as ergonomics goes. You'll see the computer here. This is reasonable. I'm also going to show you the other type of desk. Obviously, this one is a more higher end. It's a higher end model. It's not incredibly expensive. I don't believe it's more than $200 at this point in time. But this one over here, which is right near my picture of posture that's bad posture. This one's very affordable. I don't remember exactly what it cost, but it wasn't much. So there's different things you can do here. Number one, there's an angle. And you can change this angle with this little button right here. This sits on top of any normal desk, so it's a piece of cake. You just throw it on there. You can take it home with you if the workplace doesn't approve of it. But these buttons on the side, you can just click those, and you can adjust it and just have it flatten out. It's got a little shelf so your computer doesn't slide off and fall off. This is my personal favorite. It wobbles a little bit from side to side, but for the price you pay for it, it's very versatile and it's a good piece of equipment. And I don't know if you can see my friend right here that's going down towards the ground. This is what you want to avoid. This is drawn, I believe, in the 1700s when they first started realizing what was happening to people's postures as society progressed into the seated, city, urban lifestyle. And they started studying what's called Postureology. Long story short, what I call it is body imbalance. When the body's not balanced, if it's too far forward, and the weight of your own body under gravity, which is always happening unless you're in space, gravity never takes a day off. Gravity eventually pulls you down. And the problem when the head goes forward farther and farther is that it can diminish your lung capacity, it can cut off the brain-to-body communication, and it creates a bunch of muscle spasms and other health problems. I could go on and on about those. But namely, when you're sitting down, it puts many times the amount of pressure that you should have on the low back. There's a multiple effect. Once you're sitting down, the discs, the intervertebral discs in the back start to push backwards, and it's one of the main contributors towards prolapse disc, slip discs, as people may call them. And if you do that, driving is the biggest offender. It's hard to be able to get in a car and drive and not get in that position. What I do, I'll tell you personally, is I use a seated wedge. And there's this thing called the car cush. I don't get any money by endorsing them, but the car cush, it means car cushion. And it has a wedge that in the back of it is thicker, and then towards the front, so towards your knees, it gets thinner. And it helps you sit up the way you should in a car. If I go in and drive for more than 10 minutes without the car cushion and a little lumbar support, one of my vertebrae physically goes back, and I stand up and pull in my core, and it audibly pops back in. That's how injured I was, just for example. When you're standing for periods of time, it's comfortable to have one foot elevated. So you'll find with these types of desks over here, and I'll make my way back over, is that there's a little, either a rolling caster wheel that the whole desk can even slide on, and then there's little bars above that the wheel's attached to. You can just set your foot right on the bar. Just like somebody, if you've seen the guitar players, they bring a little foot pedal that they put their foot on for comfort to raise it, and it helps the blood flow not get stagnant in one side. Then you can switch off from one side to the other and go about it in that manner. So, number one rule of ergonomics, stand up. Number two, if you have to sit down, it's better to do it in a dynamic environment. So I'm going to spin this around over here and demonstrate the ball chair. So the ball chair, if you can see this isn't the ball chair I use. This is the office manager's ball chair. You want to come in for a second and show us the ball chair? Because it's not really fitting my body that well. There's different sizes for different people, so obviously the different size person sits on the ball chair, and the trick to the ball chair, and any chair essentially, is if your knees are above the level of the hip, that's what forces the back into the wrong position. If your knees are lower than the hip socket, that's much better. So that's the general rule. And you can see here if you look closely, the knees are slightly lower than the hip socket, and that is key. And that's the same thing the car cush does. By tilting the hips up and forward, it creates that lumbar lordosis, that curve in the low back that should be there. And anytime the low back flattens out or goes the wrong way, the discs and the places where the nerves come out and the muscles, tendons, ligaments in that area, they can all get irritated and be injured from that. So that's the most important thing. Yep, and you can see from the side. My other favorite thing about the ball chair, and you'll notice in the office that I have one at the head of the table that I use almost every visit, is that when I want to get up, I just kind of bounce up off of it. And if you're from a static chair, you have to use all your body weight and power to get up, but a little bounce, it just kind of bounces you right up. And that's my other favorite. Yep, you can see the lumbar lordosis brings the head back on top of the body and helps everything work better while you're working. Basic ergonomics, we find that the head position has a lot to do with these muscles that have to pull it back when your head goes forward. One other thing which isn't necessarily my scope of practice, vision. If you have vision, maybe you need a new prescription of your glasses, for example, and you can't see well, and you're leaning forward and squinting and looking into the computer, that'll naturally throw you into a forward posture, and that won't end well. That's basic seated and standing workplace ergonomics. Now, there's a lot more when it comes to body position in other areas of life. And is there anybody here that had specific questions about a certain part of either your work or your life that you wanted to know about? Our friend at Amazon. Yeah, yeah. Amazon's got just about everything. That's a good point too, yeah. Yeah, you can space things out, especially if it's a keyboard that's attached with a cable. You can move the keyboard anywhere you'd like and have the monitor, for my height, a stand-up monitor would be better, the kind on a little stand like the old Apples used to have, or there's some PCs that even still have those. And they can stand up a little bit higher, which would meet my eye level. So I would obviously want to match my eye level as close as possible. But if you have to tilt the eyes down, it's not the end of the world when it comes to ergonomics. The chairs that have the little back supports, they may use the word ergonomic in it too, that have this ergonomic back support. I want your body and your core musculature to be your back support. I don't want some artificial back support to have to hold you up. I want your own body to hold you up. Yes, good question. And those medical type of stools are good. And that's the other thing. Once I took the ball chair out of there, and the well-designed medical stools do have some spring in the cushion, and they are well done. So as long as it can roll a little bit, if you have to move, I know you do precision work, so you might be staying in the same place. So obviously if you're doing, say eye surgery, for example, and you're doing some tiny little, specific surgery and you have to concentrate for a period of time, you'll have to be in that position. But to do the best you can with what you got, and on all other tasks, you can go to standing if you can. And I find the difficult ones also is the dental industry. They have a tough time. Hygienists and dentists getting way back into the back of the mouth because they have to crane and turn and get into there. So having good ergonomics with that, it's really tough. And some jobs are just like that. So in that kind of case, you do the best you can to improve your body balance after, when you're not working, either working out, doing corrective exercise before or after, stretching, and all the things which I know you've obviously done, because I know you have good body balance. So do the best you can before and after. What I do most of the day, there can be tables that can be low, and people wonder, how do you work on that table all day? And that's exactly what I do. I pull the rhomboid and the lat on my other side, and pull it back before I do a kind of dynamic adjustment or whatever kind of correction I'm doing. And co-contracting opposite muscles, the muscles in the back. If you're going to use the front, working the opposite muscles to make the body strong from front and back. That is a key factor of this. So that's a more advanced concept, so I'm glad you brought that up. That is very true. And yeah, rhomboids and lats. Yeah, you get a wide stance and you absorb the tension and the weight of your body in the muscles as opposed to in the bones, tendons, ligaments, and the discs and the other structures. So the more you can absorb in muscle, the better, and in the strongest structure of bone. When I'm standing more straight up, I still have minimum hip distance or width on my stance. You'll see me rarely being shoe tied, like feet close together as if I could tie my shoes together. Minimum hip width or forward or back to where it's a wider stance. But obviously I'm standing tall. It's different than if I'm going to a table this low and I'm working on something down here. But you'll see me, I could have a 5 foot long stance doing some of these things. It's almost like I'm doing yoga half the day, and it works. And that's another thing, yoga, doing Tai Chi or Qigong and all these different types of corrective things, especially before you have your long day, is best. Doing it earlier in the morning before your day is better than doing it later when you're already tired and you're likely to not do it at all. Bending the knees or keeping minimum one knee bent, I'd prefer both. It's important for circulation, and you'll find people that are about to pass out have the locked knees, and that's when they're about to go. I'm going to demonstrate with the elbow, but locking the knee blocks the artery and vein in the circulation, and keeping it bent allows it to flow and allows the muscles to contract, because some of the contracting of muscles, let's say a pilot, for example, when they're taking the G-forces and they're taking all these extra gravity, so to speak, when they're flying around, they have to actually do squats and squeeze their legs to bring the blood back up to their head or they'll pass out. And it's the same kind of concept with the hair stylist or anybody that stands. Keep the knees bent. Better to move a little bit if you can shift a little bit back and forth and get into it. And I know the great artists like hair stylists or anybody that's a musician, for example, heard them talk about it, say, when I'm stage, we do our deep knee bends and they're doing this type of thing. And the more you move, the more circulation you have, the better it is. And the less you move, that's a general rule too. The more you move, the more circulation, the better it is. The less you move, the less circulation, the more health problems you're going to get. That's a good question. Everybody has a different amount of stamina with how long they can stay standing. I've seen, Karen, who works over here, she can stand all day a lot of the times, and she might sit down for a quick break to eat or something like that. But especially if you find yourself leaning and putting a lot of weight forward, that's when you know, let me just sit down. And I'd rather have you actively sit. And here's the other thing about sitting. If, like I was saying, with the wedging and sitting properly, if you can sit properly and use the core musculature to make yourself a little bit taller while you're sitting, you can hold yourself up for a period of time. The problem is we get in the habits of thinking that falling forward feels better because it's easier, because you're using less muscle.